Hi, it's Doug Holland, LMT, with another massage tip for massage professionals. Today I'm outside because I'm thinking of athletes that actually have Pes Anserinus, Tendinitis, or Bursitis, and how we can help them. So I got a cool massage tip on how I palpate to find where the Pes Anserinus is, and then what I do to massage it. So just as a reminder to ourselves, we know that the Pes Anserinus, where the tendons insert, come from three muscles. Those three muscles are the sartorius, which originates on the anterior superior iliac spine of the pelvis, and then goes down the medial aspect of the leg and inserts into the pes. We'll call it the pes for short. We have gracilis, which is an adductor. It originates on the inferior ramus of the pubic bone, and it runs down the medial aspect of the leg until it hits the pes. And of course we have the hamstring, the semitendinosus, which originates on the ischial tuberosity of the pelvis and inserts onto the pes. So we have these three stabilizing muscles of the trunk that really affect a lot of athletes or people who might have a valgus problem with their knees, which is knock knees. These individuals can have stress on there, and they talk about the knee pain that comes from it, but really it's not the knee itself, it's just close to the knee, and so we're able to help them discover where the actual issue is. So once the doctor gives the diagnosis that it's not one of the patellar ligaments and it's not the collateral medial ligament, it actually is the Pes Anserinus, then we can get to work on that. So what we're going to do first, we're going to go to the wall chart, and I'm going to show you where this is and how I palpate my way to find it, because it's a really cool trick on how to do that. And then we're going to go down to the table and we're going to work on one of the patients to show you how I do it. All right, so let's go to the chart. Okay, so here we are at the wall chart, and we can see here this is sartorius coming down and inserting on the Pes Anserinus. You can see a little bit of gracilis coming down, and of course semitendinosus, which is the hamstring on the posterior side. You can't see that, but you can see the tendon coming through here also. So this is the Pes Anserinus of the tibia right here on both legs. Now I have a really cool tip on how I find it. The way I do that is I work from a distal aspect to the proximal aspect of the tibia. And if you notice, this is kind of staying in the sagittal plane right here as your finger runs medial right here. So I use my index finger and I run it medially up the tibia. I'm working superiorly, and the second all of a sudden I feel this oblique change in direction of the bone itself, I'll feel this oblique change of direction. When I get into that groove, then I just simply, which is right about here, I just simply move about an inch to the lateral. So I move laterally about an inch on the anterior surface, and bam, you're right in it. Then what you can do is you can follow that up, and you can stay on those tendons all the way up in this area right here, and you can bring a lot of relief. The way I like to do it is circular friction in here, cross fiber friction, and another thing I like to do is to pin these tendons with my finger while the leg is externally rotated and flexed, and then when I extend the leg by keeping the compression on here, we get a nice stretch and relief in here. So that just gives you an idea. When I show you on the patient, when I'm palpating, this is the direction that I follow on either side. It doesn't matter, it's going to be the medial aspect. But this is the sweet spot that people feel pain. They think it's the knee itself, but it's not. It's actually right in here where they're feeling on the medial aspect. The reason we want a doctor to look at is we want to make sure it's not the collateral, medial collateral ligament here that stops medial flexion. So as long as it's not that, we know it's down a little bit deeper. It's usually 2 or 3 inches below the kneecap itself. Then we know, yeah, it's probably the Pes that's causing the problem. So let's go to the patient and I'll demonstrate. So what we do is we find the tibia, and I just simply take my fingers and I'm placing it on either side of the bone, and I'm palpating upward. I'm palpating upward. I'm sliding the index finger along, And then all of a sudden, I feel that oblique change right there. I feel the oblique change right there. So then what I do is I take my finger, I hold, and I measure about 1 inch laterally onto that surface. And there we are. There's where the Pes is. And we can draw a V there, or where those tendons are actually coming into play, which I'll get another marker here. But basically, these tendons come in like this, right through here, right through here like that, the 3. And this will cause the athletes a lot of pain because it's involved in directional changes. So we see baseball players, we see soccer players, we see people that like to enjoy racquetball. Anytime you're doing quick directional changes, especially medial and laterally, these tendons are put under a lot of stress. So the way I like to massage them is this. I like to take the leg and bring it into flexion and external rotation, like this, and then I will put my thumb right on the Pes Anserinus. I will pin it with compression, and then I will extend the leg. That forces a stretch right at the point of insertion. Then I'll release the compression, I'll flex the leg again, externally rotate it, and I'll go up maybe a 1/4 inch or a 1/2 inch. I'll use compression again. Now this can be very, very painful on somebody who has inflammation here, either in the bursa or tendinitis. It doesn't really matter because they're so close together, you might as well kill 2 birds with 1 stone. But I'll take that compression again, and then I'll extend the leg while holding pressure. And then I'll do it again, and I'll work my way up through those tendons, stretching, compression, stretching. So that's one way we do it. The other way, I like to take my fingers, and then I'll do circular friction over the area. And then I'll work circular friction all the way up those tendons into the adductors themselves. And the last way I like to do is cross fiber friction. And what I do is I hold my finger across, I grab a hold of the foot, and then I externally and medially rotate the leg across that. Boy, that really can get them. So I'm just using pressure from my index finger to go across that as I'm working the Pes Anserinus. So those are the 3 ways to bring about stress release and any issues that might be going on with the inflammation of the bursa. That's the best way we found. You can also use cold compression there, cryotherapy, to bring down inflammation on a patient that maybe just came off the field. But as long as we know there's nothing serious going on in the knee itself, this is just a tendon issue, boy, we really can come through on that. Well, I hope you enjoyed that tip on how to massage somebody with Pes Anserinus, bursitis, or tendinitis. Try to say that 5 times fast. If you did enjoy this tip, please hit like and subscribe. We really appreciate that. And just remember this: if there's no discomfort on the table, well, it's nothing more than a foo-foo massage.